Good afternoon from Asia. It is 12:30, just after 12:30 here in Hong Kong, and it's just after 1:30 over in Tokyo, where we're delighted to be joining the Future and Balance event addressing childhood obesity today to protect the health of future generations, which is, of course, a special side event as part of the Tokyo Nutrition for Growth Summit 2021. Thank you to everybody there who has pulled this event together, be they in Tokyo or Manila at the Western Pacific office of the World Health Organization or elsewhere. Good afternoon, ministers, ladies and gentlemen. My name is James Chow, and I am the WHO Goodwill Ambassador for Sustainable Development Goals and Health. And it really is my honor and my joy to moderate and welcome you to this very important summit. This session, which as we know is called Futures in the Balance, is just that. I think we're sitting at this tipping point where we think, are we going to safeguard the health of our children and therefore as they grow into adults, or are we not? That's the opportunity here. And that's the opportunity that's being put together by the co-organizers, the Ministry of Health, Labour and Welfare of Japan, also the National Institute of Health and Nutrition of Japan, and the World Health Organization Regional Office for the Western Pacific. We're here today to talk about the gravity of the threat that childhood obesity poses to the health of current and future generations and what together we can really do about it. Well, to kick off this program, to set the tone and to bring us together in one space, we're delighted to be opened by Dr. Takeshi Kasai, who is, of course, the Regional Director of WHO Western Pacific. We ask Dr. Kasai to speak to us now, please.
Good morning, good afternoon, and good evening, honorable ministers, distinguished guests, ladies and gentlemen. Thank you for joining this side event on the importance of addressing childhood obesity today to protect the health of future generations. We choose to call these sessions Future in the Balance, because that is exactly what is at stake here. The future health and well-being of today's generation of children and young people, as well as the generation who will come after them. As I was preparing for this session, I thought a lot about conversation I was privileged to have a few years ago with the Honorable Joe Williams, the former Prime Minister of the Cook Islands, who sadly passed away last year. He told me one of his greatest regrets as a politician was not being able to do more to protect the health of future generations. I think of these words often as a plea to all of us to do more. Childhood overweight and obesity is one of the most serious public health challenges we face in the 21st century. Childhood obesity rates have skyrocketed in recent years in our region and around the world, especially in urban areas, as a result of increasing sedentary lifestyles, the availability and affordability of ultra-processed foods high in fat, sugar, in salt, and the aggressive marketing of these foods to children and their parents. Right now, 1 in every 4 girls and boys in our region is overweight or obese. This affects a staggering 93 million children. Rates of childhood overweight and obesity are increasing exponentially, meaning that we are fast hurtling towards a future where half of all our children in the region are overweight or obese. This is an unacceptable threat to these children today and to their future health and well-being. I believe that we have a moral imperative to do all we can to change this future. The health problems that come from childhood overweight and obesity are wide-ranging and significant. Overweight and obesity increases the risk of cardiovascular diseases such as heart diseases and stroke, diabetes, musculoskeletal disorders such as osteoarthritis, and the range of cancers. It can also contribute to mental health problems, such as depression, and other social challenges, such as discrimination. Are we really comfortable that this is the future we're condemning so many of our children to? If not, then now is the time to act. Tackling childhood obesity is not straightforward, but it is urgent. There's no one single simple solution, but we know that through a combination of policy and regulatory measures, we can make a difference. And I'm really looking forward to hearing about the different ways of countries and communities around our regions are addressing this challenge during today's session. I hope the examples we hear about today will motivate and inspire policymakers and leaders to scale up efforts to tackle childhood obesity as a part of countries' commitment to achieving the nutrition-related SDGs. After 22 months of response to COVID-19, it has made it clear that health and broader social and economic development are inextricably linked. Therefore, investing in health today will be a critical determinant of economic and social prosperity tomorrow. And this is why we must act now to reduce and prevent childhood obesity, because this is an investment in the health and well-being of the children today, as well as an investment in sustainable development for the future. I look forward to working with all of you to achieve this. Thank you very much.
Thank you very much to the Regional Director, Dr. Takeshi Kasai, who mentioned there the passing of Dr. Joe Williams. And of course, our condolences to everybody who worked with him. And of course, he contributed so much to public health, especially to the fight against lymphatic filariasis. We're honored now also to be joined today by Dr. Tomifumi Sone, the President of the National Institute of Public Health, which of course is one of our co-organized today as part of the Ministry of Health, Labour and Welfare of Japan. He's attending the session live from the Nutrition for Growth Summit venue in Tokyo. Dr. Sone, I wish that we were there with you in Tokyo, but if you can best represent us there from the venue and give us your comment, please.
Thank you. Distinguished participant and honorable guest, it is a great pleasure and honor for me to make a few words on this precious occasion. I'm Tomifumi Sone, President of the National Institute of Public Health under the Ministry of Health, Labour and Welfare. I would like to talk Japanese situation of child obesity and some nutritional policies and implementations, and then the roles of National Institute of Public Health for capacity building. The proportion of obese tendency children whose weight is 20% or more heavier than the standard weight for height in each age was around 3% for preschool children, around 10% for male school children, and around 8% for female school children in Japan in 2019. The proportion in each age has been relatively stable or slightly increasing over the last decade. However, there are some concerns that behavioral changes of children due to COVID-19 pandemic since last year may affect the proportion. This slide shows nutrition programs for mothers and children in Japan, national policies, health services, guidelines, and surveys cover early stages of life course for providing appropriate nutrition. In implementing these programs in various settings, dietitians and registered dietitians may play central roles in Japan. Registered dietitian is a national license and has more management role. More than 37,000 dietitians and registered dietitians work for schools, nurseries, and child welfare facilities to improve children's nutrition. Let me introduce our National Institute of Public Health for a while. Former National Institute of Public Health was established by the government in 1938 with financial support of Rockefeller Foundation. Current NIPH was re-established and relocated to Saipan Prefecture in 2002. One of our missions is training of public health personnel working for the local governments. Training courses for nutritional personnel of local governments have conducted for many years. Over 4,000 trainees have graduated NIPH nutrition courses since 1938. Western Pacific Regional Office and NIPH have jointly conducted workshops for the prevention and control of NCDs for 6 years since 2013. The workshop designed to build capacity of personnel in charge of NCD prevention and control in the member states. Preventing childhood obesity was the main theme for the fourth workshop in 2016. Participants visited a municipal school lunch supply center. It's a big kitchen, actually, and then a junior high school for having lunch together with students. Today, in this regional session, many prominent speakers present their experience on school-based or community-based approaches, marketing regulations, and local food labeling. These experiences will definitely give us broad scope and practical measures to tackle this child obesity problem, which is closely related to our future. A few weeks ago, I went to a ramen noodle restaurant in my neighborhood for lunch. Surprisingly, at that restaurant, the price of regular size, double size, and triple size are all the same. There was a family of parents, a teenage girl, and an elementary school boy next to my table. The mother ordered triple-size ramen noodle for all members. The daughter hesitated to eat such a big bowl. The mother said, "You should eat this. It's a very good deal." I think we have still many things to do in this field. Thank you very much for your attention.
Thank you very much to Dr. Sone for sharing that very important story there about how pricing and advertising and how things are presented to us in terms of choices really impacts, how we choose and of course our own lifestyle behaviors. We're going to hear examples also from countries through the region about their work to address childhood obesity. But before we do, let's set the scene with a short video that's been created by the WHO Western Pacific Regional Office about why childhood obesity is such a critical issue for our region, especially for future generations. Let's play the video now, please.
Meet Avoca, a teenage girl living on a beautiful island in the Pacific Ocean. She relaxes by eating sugary food and sweet drinks. Since she was a small child, she's been eating a lot of ultra-processed food, high in sugars and fat. She's also one of the many children in the Western Pacific region who don't get enough physical activity. The food was affordable, but it was neither healthy nor nutritious. With little physical activity, Avoca has gained weight over the years. In the Western Pacific region, she is one of an estimated over 93 million overweight or obese children, and this number is growing at an unprecedented scale. In only 6 years from 2010 to 2016, the number has increased by 43%. If current trends continue, millions more overweight or obese girls and boys will be at greater risk of diseases like diabetes, heart disease, and cancer. These diseases already take millions of lives too soon, putting huge pressure on health services. People who are overweight and obese can also experience discrimination, lower income due to increased health costs, and depression. Thankfully, solutions exist to support Avoca and reduce child and adolescent overweight and obesity in the Western Pacific. Individuals, families, communities, and governments all play a role to make healthy living easier by making healthy, nutritious food more available at home, school, and in the community, especially for vulnerable populations. Countries can also reduce people's consumption of cheap and unhealthy food by adopting policies such as taxing these foods and beverages, stopping marketing them to children, while also adding subsidies to healthy foods to make them more appealing. By promoting healthy physical activity at every stage of a child's life, at home, in the community, and at schools, exercise becomes fun and social, and healthy behaviors are developed early. Everyone has a role to play to prevent overweight and obesity in order to ensure a healthy future for our children and generations to come. To learn more, go to www.who.int/Western Pacific/health topics/obesity.
Well, that really is a fantastic video. Thank you to everybody over in Manila for creating a wonderful storyline and embedding all those important messages within them. As we've just seen, childhood obesity is a major public health problem in the region globally, but specifically to the Western Pacific, which, if unaddressed, will undermine progress toward achieving the Sustainable Development Goals, which, as everyone knows, are the 17 goals in combination. There's a deadline of 2030 to meet them, and every single government on the planet has promised to meet that in, well, less than 9 years' time from now. We're going to hear that prevention is the only feasible option for curbing this epidemic, and we're going to listen to 3 countries in our region, Tonga, Brunei, Darussalam, and our hosts, Japan, on how they're tackling this issue. Let's go first now to the Kingdom of Tonga. We're thrilled to be joined there by the Honourable Amelia Afuha'amango Tuipulotu, the Kingdom of Tonga's Minister for Health. And it's my pleasure to introduce her now. Minister, we're going to hear from you about schools and communities in your country, what they're doing to work together to tackle obesity. Minister Amelia, it's over to you.
Thank you, moderator. It is an honor for me on behalf of His Majesty's government to be able to present at this very important summit, Futures in the Balance, given a current very off-balance situation, and hopefully building stability towards the future for our children. And of course, supporting what have been said about the importance of health of our children, and that is wealth for the small island developing states, and of course the Pacific. I am delighted that we as Western Pacific region leaders have the courage now to lead and to demonstrate and to act on this very important and very critical topic, childhood obesity going into the future. I will be sharing some of the experiences from here in Tonga on how school and community-based programs facilitate healthy eating, and how utilization of physical policy, innovation, and actions can contribute to tackling obesity in the kingdom, and of course within the Pacific context. The background, the high childhood obesity rate in Tonga, given the latest survey of 2017, 56.4% are overweight within our children, and 25% are obese. This is shocking, and if the current trend continues into the future, it will be very dangerous given a high dependency already in our economic situation. Tonga and the Pacific will not have many options going into the future given very expensive treatments and drugs to combat NCDs into our children's future. For me, there is a need to build the environment so we can inspire our children to desire. That is very important for me. Our children to be able to desire and embrace lifelong healthy lifestyle behaviors. So what they will be embracing at the school will be lifelong healthy lifestyle behaviors. And of course, the need to intervene now at the earliest stage to protect the future of Tonga. And of course, the need for a whole of government approach. And of course, the way I look into the situation is that other government ministries must lead, must be driving this work going forward. They must be empowered. Ministry of Education, Finance, and Agriculture. And of course, for me, it's very critical that in the classroom, teachers, principals lead at the front the lifestyle, healthy lifestyle behavior, so that all efforts will not fail in the long run. Sometimes we would go to school and then we will still lead at the school for sustainability. School teachers and principal must lead the work within the education system. And of course, a strong engagement with the community so that there is some ripple and mutual benefits from the schools to the communities where the schools are located. Next page, please. Of course, the physical measures and policies have been the approach globally, and of course, it has worked to some degree, but more is needed to be done. And of course, there's reduction of tax for imported fruits and vegetables, introduction of tax for sugar, sweetened beverages, introduction of tax for unhealthy food, mutton flaps and turkey tails, and drop in consumption of unhealthy food. However, given all these physical policies, we know that it's still not enough. School policies at school that it must also ensure healthy food are available at canteens and vendors at the school. But this must be closely monitored also. Sometimes it is implemented and complied to when healthcare workers are around and when healthcare workers are not in close contact with the school. Canteens and vendors will continue business as usual with the importation of fast food. And of course, implementation of food policy is key going forward. Next slide, please. Our health promoting school and the community must work together to build that positive environment whereby our children are promoted to live and model healthy lifestyles. And of course, we must conduct an annual school-based program to monitor the school and monitor their progress into health promoting school. And of course, with transformation of school environment, having better food policy, it will enforce promotion of vegetable gardens, hand washing basins, and of course, improvements in the toilet, and hopefully less unhealthy food sold at the school premises. Also, we would like to promote active learning environment to inspire the children into active lifestyles. So let's say, for instance, within a semester that the theme could be to a specific type of sports that will be facilitated on a weekly, daily basis within the school. And of course, we need at the school to inspire our children towards a shift of mindset, that the answer to the NCD crisis is just in our own backyard. A lot of students may be thinking that the answer to to obesity and childhood obesity is outside their mandate, but we should be facilitating our children to embrace and be proud of their local village food. And of course, actively utilizing and empowering schools and children as catalysts for change for their parents and of course the community. And of course, active demonstration and inspiring our children towards cooking our local traditional food in portion, cooking yummy meals for children and of course families and all ages. And of course, innovation actions. At the school that we promote standing desks for teachers and students, and of course some fun sports per semester, and encouraging innovation like school walking bus, where children are dropped off at a specific area, then walk from there to school. For the future generation, there is a need to measure going forward the progress within the school programs, and of course progress with the health of our children. And of course, there is a need to conduct research that are well grounded in the context of Tonga, in the context of schools, in the context of their families. And of course, using traditional values to encourage eating traditional local portion food is key. And of course, encouraging teachers to lead the healthy lifestyle at the school to become good role model for the students. One of the things that can be embraced is to encourage traditional dancing, where children take pride in their traditional dancing and to use it to inspire physical activities. And most importantly, community engagement and a whole of society. But going forward, we need actions are critically needed, rather than having a lot of policies that are not able to be acted upon. The last slide, please. The last one, please. And of course, this is the Ha'amonga here in Tonga, which and the blowholes here in Tonga. These are the strength of working together. We must collaboratively row together so we can build a stronger future, stronger, balanced future for our children, and of course, our health and our economy. Thank you very much.
Thank you very much to Minister Amelia from the Kingdom of Tonga for sharing some of your thoughts, your ideas, and also your solutions as we move forward now to another country, this time from Asia, with a different context and a different set of issues. Of course, it is going to be unique. We are unique as individuals, and so are our communities. And this time we're going to turn to Brunei Darussalam. We're delighted to be joined today by the Honorable Dato Setia Dr. Haji Mohammed Isham Jaafar, the Minister for Health, to talk about how Brunei is tackling the marketing of food to children through its recently launched Code on Responsible Marketing of Food and Beverages to Children. Let's play now the video from Minister Isham.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. Honorable Ministers, distinguished delegates, ladies and gentlemen. In 2020, UNICEF reported that globally 38.3 million children are overweight, an increase of 8 million in numbers since the year 2000. Childhood overweight and obesity are among the most prominent global public health challenges today. Overweight and obese children are more likely to stay overweight and obese into adulthood and are evidently more at risk of developing non-communicable diseases such as diabetes or cardiovascular diseases. It impacts not only their health, but subsequently their educational outcome and future performance. Studies reveal that negligent marketing of unhealthy food and beverages to children pose a significant risk factor that consequently bring about child obesity, inevitably succumbing to NCDs. Policies on advertising need to be augmented as a means to protect the children from this harmful marketing. It is also found to be the most cost-effective way of controlling non-communicable diseases within the population, tackling the problem at the grassroots. Furthermore, addressing childhood obesity is one of the key recommended actions by WHO, and additionally, protecting our children from the marketing of unhealthy food and beverages is also in line with the United Nations Convention on the Rights of Children in Article 24. In Brunei Darussalam, the proportion of overweight and obese children is fairly high. The National School Health Screening Program conducted between 2016 to 2020 among Bruneian school children years 1, 4 and 7 revealed that 1 in 5 students are overweight or obese. And our Global School Health Survey conducted on school adolescents aged 13 to 17 in 2014 and 2019 consistently revealed that more than half were overweight or obese. As with other countries in the region, obesogenic environment exists in Brunei Darussalam. Local surveys reported advertisements from billboards, newspapers, banners and radio commercials mainly depict unhealthy food and beverages. It is revealed that more than a third of advertisements in the local newspaper promote cheap fast foods, and some businesses even post them up to every week. Nearly half of the mini markets put on display posters of unhealthy beverages, and more than a third display unhealthy food. More than half of all billboard advertisements were of unhealthy food too. And more commonly, more than half of local radio commercials advertise fast food, and nearly 3/4 advertise beverages with high sugar content during peak hours. Alarmingly, the placement of these advertisements also exists even in the vicinity of school areas. The impetus for these reforms is to protect our children from the harmful influence of unhealthy food marketing and premeditatively tackling non-communicable diseases. The Ministry of Health of Brunei Darussalam takes a holistic initiative as part of its national health policy. Code of Responsible Marketing of Food and Beverages of Children in Brunei Darussalam was fully endorsed in January 2021 and launched in March 2021. Brunei Darussalam will regulate advertisements and promotion of food and beverages to children on various platforms in phases starting January 2022. This will be followed by regulating sponsorships from food and beverages industries. Compliance of the code is currently on a voluntary basis with plans for it to be upgraded and officially mandated in the near future. Advertisements portraying food and beverages will be assessed by the Control Committee of the Code Against Nutrition Profile Model, which was adapted from WHO Nutrient Profile Model for the Western Pacific region. Various criteria must be fulfilled according to the different colored categories. An evaluation of the code will be addressed administratively. The journey towards the development of this new policy was lengthy. It involved numerous agencies and went through various engagements, multiple consultations and discussions to refine and enhance the draft document, concluding with mutual agreement from various stakeholders. The Ministry of Health of Brunei Darussalam fortunately had the assistance of WHO Western Pacific Regional Office, imparting technical advice and guidance along the way until the document was finalized and fully endorsed in January 2021. At this point, a multi-sectoral committee was set up, involving the relevant regulatory agencies to discuss the implementation of the code and strategizing monitoring of compliance. Whilst in its infancy, Brunei Darussalam started with a soft approach, educating and guiding the community, specifically the food and marketing industries, through various methods of socialization of the code, adaptation of the new guidelines, encourage responsible marketing of food and beverages to the community and in particular to the children. In the long run, this policy is projected to be an invaluable investment for the country, as stated with evidence by OECD that for every $1 invested in tackling obesity, up to more than $5 will be returned in economic benefits. For the overall economic and physical health of the nation, we are hopeful that more food and beverages manufacturers and marketing agencies collaborate towards ensuring balance in practicing their responsibility in their advertisement, notably to the children. The development of this code is not without its challenges. These include the struggle of securing commitment from the stakeholders throughout the process, the limited resources for reference from neighboring countries, the resistance from stakeholders, such as getting agreement on restrictions on peak time for advertising on selected media channels, the limitations among the MSMEs on restrictions on social media advertising, affected revenue as a consequence to the implementation of the code, and constraints on the agreed time frame for feedback on applications from the advertising agencies. Thank you.
Thank you very much to Brunei Darussalam for your comments there. And that leads me to introduce the host country, Japan. For that, we're very happy to be joined now by Dr. Hidemi Takimoto, who is at the physical venue in Tokyo. Dr. Takimoto is chief of the Department of Nutritional Epidemiology and Shokuiku at the National Institute of Health and Nutrition of Japan. She's here now to share with us how Japan is inspiring future generations to adopt healthy diets. Dr. Takimoto, please.
Thank you very much for introducing me. I'm very happy to share the Japanese experience with the audience. My name is Hidemi Takimoto from the National Institute of Health and Nutrition, Japan. First, I would like to look back at the era of severe malnutrition among children in Japan. In 1920, when the State Institute of the Study of Nutrition, currently it is my institute, was founded, infant mortality rate was 165.7 per 1,000 live births, and malnutrition was also prevalent. The founder of our institute, Dr. Saiki, applied the results from intervention studies in malnourished children, and the institute proposed the treatment diet as shown in the slide below. He showed values for requirements of energy and protein. Furthermore, in 1932, Dr. Saiki submitted an opinion on universal school lunch programs to the Minister of Education to promote school lunch programs throughout the nation. However, this was not implemented because of the subsequent World War II. After the World War II, Japan was struck with serious food shortages, and many children suffered from malnutrition. In January 1947, 2 years after the war ended, the school lunch program started. And furthermore, in 1954, the School Lunch Program Act was implemented. So the school lunch program was legally based from this year. This resulted in improvements in physical growth of school-age children, as shown in the figures below. The left-hand side is the trend in mean height of the children, and the figure on the right is the mean weight. You can see that during the war times, children's growth had been severely affected, but it quickly improved after the initiation of the school lunch program. Here are the major developments in maternal child nutrition policies in Japan. as early in 1958, we had the basics of infant complementary feeding. And in 1960, the first national growth survey on preschool children was conducted. And ever since then, every 10 years, we have this monitoring survey. In 1985, the first national nutrition survey of preschool children was conducted, and this was also conducted every 10 years since then. In 1995, the basics of infant complementary feeding was revised, and starting of solid foods was recommended at 5 months. In 2001, we had the Healthy Parents and Children 21 project, and also the 21st Century Born Birth Cohort Survey was started. In 2005, we had the Basic Act of Shokuiku. Shokuiku is the Japanese term for diet and nutrition education. In 2006, we had the dietary guidelines for pregnant and lactating women made public. Next year, the basics of the infant complementary feeding was revised to guidelines of breastfeeding and weaning for infants and preschool children. In 2019, this was revised, and we had the basic law for child and maternal health and child development implemented. And this year in March, the official dietary guidelines for pregnant and lactating women was revised to include pre-pregnant women. And at our institute, we conducted systematic reviews to revise this guideline. And this is our website page in Japanese. Due to the concerted efforts among the government, the local governments, schools, and the communities, overweight among children remains low in Japan. This is the data from the OECD, Health at a Glance. And the red bar on the left-hand side of the figure is the OECD average, and the blue bar is for Japan, which is very low compared to the other developed countries. On the right-hand side, I'm showing you the change in overweight, including obesity among 5 to 9-year-olds, 1990 to 2016. You can see that the blue dot is for Japan. The change has been very small, which means we were able to control the increase of overweight obesity. However, we're facing new problems. One is the decreasing birth rate and the increase in low birth weight infants. The number of births per year have nearly halved from 1951 to 2018. However, the proportion of low birth weight infants have increased since the mid-1970s. This coincides with the increase in underweight among young women in Japan, as confirmed in the National Health and Nutrition Survey data. However, happily, this increasing trend has halted in recent years. As I have introduced to you, we have revised the dietary guidelines for pregnant lactating women this year. The left-hand side is the official pamphlet from the Ministry of Health, Labor, and Welfare, which is to be distributed to all pregnant women registering at their local public health centers and also at prenatal clinics. To aim further decrease in low birth weight infants and to promote the health of reproductive age women, we have these 10 key messages. I'd like to introduce to you and just read out to enjoy a well-balanced diet before you get pregnant and achieve your adequate energy intakes through taking adequate staple foods. The main staple food in Japan is rice, and side dishes help you get enough amounts of vitamins and minerals. Arrange main dishes so that you can take enough protein. Dairy products, colored vegetables, beans, small fish are all good sources of calcium. And adequate weight gains in pregnancy is ideal for you and your baby. Also, a well-balanced diet helps you breastfeed. Be physically active, but avoid excess. Keep away from smoking and drinking. And finally, support from your family and friends helps you enjoy a healthy daily life with your baby. By applying continuous monitoring of the physical status of the child population, Japan were able to accomplish improved nutrition among children through nationwide programs such as school lunches. Decreasing birth, relatively high proportion of low birth weight infants, nearly 10%, in spite of low infant mortality, may pose a future burden of non-communicable diseases in Japan. A comprehensive approach for promoting the health of future generations is still ongoing, starting from preconception. Thank you for your attention, and I'd like to thank members of my department for supporting this presentation. Thank you very much.
Well, thank you very much, Dr. Hidemi, for your wonderful presentation and for reminding us that the opportunities are there to close the gap on how we live and to safeguard the generations that come after us. We're now moving on to the next part of our program, the panel discussion, for which we're joined by a stellar lineup of experts to discuss the different dimensions in which action is needed to address childhood obesity and how different experiences from around the region and indeed the world can inform future action in this area here in the Western Pacific. Our 6 panelists are Dr. Sandro Demaio, Chief Executive Officer of VicHealth Australia, Dr. Takashi Yamono, Principal Economist at the Asian Development Bank, Ms. Zalma Abdul Razak, Director of Nutrition at the Ministry of Health in Malaysia, Dr. Delvina Nand, Health of the Wellness Unit at the Ministry of Health and Medical Services in Fiji, Ms. Vasuki Utravati, Senior Deputy Director, School Health Outreach at the Health Promotion Board Singapore, and also Ms. Carmelita Aguila Abalos, the Mayor of Mandaluyong City in the Philippines. Well, before we call on our first panelists and really dig deep into the issues that we're here to debate, we want to share with you a video which shows the real-life experience of one parent struggling with how to deal with the impacts of harmful marketing of unhealthy foods to her own child. We take a look now at this story of Gong Beibei from China.
现在的社会的这些食物啊，没法辨别出它的真实性。你不管手机一打开，有太多信息了，还有益于孩子智力健康。看到这个明明都不好的东西，这么多糖，你还说什么健康对你什么怎么发育怎么样，什么怎么样怎么样？我叫龚 baby， 我是个演员，然后我有一个丈夫，有一个孩子，3口之家，对。年轻时候哪知道什么好吃，觉得好吃就吃，就后来慢慢有了孩子以后，给我一个很大的在食物方面这个注意，然后也希望他有个好的健康的那个习惯嘛。所以我从小孩开始喂辅食的时候。 我就开始就很注重，3岁之前尽量让他少接触这些有些糖的，所以他就最起码3岁之前是能我稍微控制的。我这次去拍戏，我就看很多小孩啊，我就看他们基本上主食都不怎么吃，就天天各种各样的零食，我真还挺担心的。这广 广告啊，什么说这个怎么样，这个怎么样，有些还结合那种他喜欢的卡通片，结合那种东西糖果一起卖。其实他真正的不是说想要糖果，他真的是要那个玩具，玩具里面很多糖果。我觉得这个是吸引小孩的东西，对，所以很多厂商是很聪明的，从玩具开始，或者而且是有连续性的，你知道吗？我觉得对于很多父母来说的话，也是因为各种各样五花八门的东西来，所以是辨别能力还是比较挺难的。然后我觉得需要社会啊各个方面啊国家啊一起帮忙，一起去辨别，一起去给予引导。比如说这个产品根本就是所谓的3高就很糟糕的一个产品吧，就国家最起码把这番控制，我们也就省很多事儿了。
That's a really excellent video, I think, which highlights what many parents struggle to go through. Baby was talking about the overwhelming advertising that's thrown over at you and that very clever use of toys and then the whole collections. I think that's a great video, possible if we can share that on social media later. But you can find it at the WHO Western Pacific website by going /people at the end of that address. So let's go now to the panel discussion. That video is the perfect seg into our first panelist, Dr. Demaio from VicHealth in Australia, who's going to talk to us more now about food marketing. I mean, Sandro, there's very strong evidence to show the association, the links between food marketing and advertising that targets children like the boy that we saw there in the video, and increasing rates of childhood obesity. As we saw in Ms. Gong's story, children like her own child are exposed to huge amounts of food marketing, and it's just relentless. It just keeps coming at you. The advertising, the little sweets at the checkout when you're paying for your groceries. In particular, these days, our children are not necessarily as active. At least we can say there's a challenge because we're competing with the smart devices, the phones, the screens everywhere, which they also use for education, particularly in remote learning. So we can't get ourselves away from it. How do we work with it? How is food marketing in this 21st century impacting our children's health? But I'd like you to take that a step further and tell us what some of the ideas and solutions are to meet that challenge.
Thanks, James. Distinguished guests, ministers, colleagues, friends, and young people, good morning, good afternoon, and good evening. Food marketing is ubiquitous. Everywhere we turn, billboards, print media, sporting grounds, television, radio, T-shirts, and increasingly on mobile phones and computer screens, someone is trying to sell us something, and very often something that is unhealthy. And quite frankly, there is no escaping it. The ubiquity of marketing is particularly challenging for children who do not always recognise marketing and understand its pervasive intent, including for harmful products like unhealthy foods and snacks. This is especially alarming, though, when we know that marketing is effective and that the more marketing for harmful products like ultra-processed foods children are exposed to, the more likely they are to consume these products. While regulations have been implemented to limit exposure to marketing in traditional formats in some countries, like during children's usual television viewing hours, regulations aren't keeping up with the rapid evolution of marketing in digital spaces. Children are engaging with technology more than ever before. Over the past 2 years in the coronavirus pandemic, we have all experienced an acceleration of engagement in the digital world, and it has cemented itself as a foundational element of children's lives. Children have had to rely on digital technology for education, social connection, and entertainment. Marketing reaches children both intentionally through targeting, and by its infiltration of every space and content children and their parents exist in. Corporate capture of childhood and the risk of harm through the digital space is particularly clear in children and adolescents, as they are more susceptible to marketing of harmful products. Measures to keep children safe and healthy do not keep and have not kept pace with the rapid evolution of technology. In Australia, 2/3 of 6 to 13-year-olds either own or have access to smartphones, and 94% of 14 to 17-year-olds have a smartphone. YouTube, the most popular form of social media, is used by 86% of teenagers and 80%, or 4 in 5, of children aged 8 to 12. So what can be done to address this? Well, ensuring children are protected from harmful marketing is complex, but not insurmountable. There are inspiring examples of leadership at national levels to ensure children have safe and healthy access to digital spaces. Children's right to participate in the digital world must be balanced with the right to be protected from harm when they are navigating these online spaces. With the multi-sectoral and potential cross-border nature of digital marketing, action needs to be taken across sectors and jurisdictions, local, state, national, and potentially also through global mechanisms. First of all, through the platforms like Google, Instagram, and YouTube. Secondly, through ad agencies to ensure that the systems that they use and the methodologies are transparent and children's online privacy can be protected and exposures can be protected. And thirdly, through and addressing harmful industries themselves to ensure that children cannot be exposed to or targeted with harmful online marketing. Most importantly, we need to involve young people to help shape our responses and navigate how we as public health stakeholders and leaders take action that will benefit and protect children and young people from harmful marketing. It needs to be by young people, with young people, for young people. As we build back better and fairer after the pandemic, we need to put children's perspectives, rights, and participation at the very heart of efforts to protect them. Examples from around the world worth noting: the industry, it is important to note that industry self-regulation of harmful marketing has not been sufficient. And therefore, Spain's Ministry of Consumer Affairs will soon ban advertising of junk food to children on TV, radio, internet, social media, and apps. Alongside new front-of-pack labelling and warning labels, Argentina is also banning advertising to children of food marketed with black warning labels signalling harmful ingredients and prohibiting sales of these unhealthy foods in schools. In the UK, an age-appropriate design code, the first in the world, sets out 15 standards for online services to ensure that data collection from children is minimised as a default, and the UK will soon ban online advertising of junk food. But as yet, no country has implemented adequate measures and means to protect children in the digital space. James, colleagues, we are at a crossroads. As we emerge from this pandemic, a pandemic of inequity, we must grasp this opportunity to protect, promote, and strengthen the health and well-being of young people across our region and beyond. Thank you.
Thank you very much, Sandro Demaio, for laying out the landscape there for us. And also, I think what was interesting is hearing there what governments are doing. I mean, part of it, you can sit back and say, how and why did it take us so long to reach this point to take that kind of legislative action? But at the same time, hearing the examples, say, for example, in the UK and Argentina, among others that you mentioned there, show that there are ways around this to curate the choices that our children have, and also the parents, the grandparents, the caregivers, the whole community around that child. Thank you very much, Sandro. Let's push on now by looking at the economic case, the scaling up actions to address childhood obesity. Is there, in fact, an economic case? Well, we're delighted to have Dr. Takashi Yamono, who is the principal economist at the Asian Development Bank. Dr. Yamono, the Asia and the Pacific have not only experienced rapid growth, as we've seen, especially in the post-Second World War period, but in parallel, we've seen a rapid increase in childhood overweight and obesity. I mean, particularly over in China, where I am right now, this rapid economic growth and this surge in disposable income has given way to lots of choices, but also not necessarily lots of good choices. And I remember asking someone many years ago, I mean, why do parents indulge their children in this way? And they say, well, sometimes the grandparents feel that in years past in their generation, they didn't even have enough to eat in terms of quantity. So there is a cultural psyche that's in there where you try to do the best for your child, but sometimes what you think is the best is not necessarily the best. There are lots of historical and social consequences. Dr. Yamano, what is the implication of the childhood obesity problem, the crisis that we're seeing here for the regional economic development? And again, as I asked Dr. Demaio just said, what can we do about this overwhelming problem?
Okay, yeah, thank you very much. Thank you for the question and thank you for inviting. As you said, this problem of obesity and overweight is a result of economic development to some extent. Due to the rapid economic growth, the consumption, the income of people have increased and consumption level have increased. We recently published a report describing all these developments and people shifting to animal products, food, and processed food as discussed already. So here the economic incentives that has been built in the past of economic development needs some adjustment to take into account of the economic costs and the health costs of the obesity and other health related issues. On the obesity and economic cost of economic impact, unlike stunting, there's still a number of studies is small. On stunting, there are many studies that describing the individual and economic-wide impacts of childhood stunting, how the childhood stunting affected child development, not only the height, but also the brain and other functions, and reduce the educational attainments and end up reduced lifelong earnings estimates ranges from 10% and higher, and then results in the overall GDP loss. On obesity, the studies and the pathways are still not established yet, as far as I know. And many studies on obesity look at the expenditure of the adult obesity, the medical expenditure at the private level and the public level, and estimates how that the medical expenditure put pressures on public funds on the medical expenditure and insurance payment. But these are those people who can afford to visit the medical facilities and see doctors and pay medical fees. Many people in developing Asia don't have access to medical facilities. Even if they go visit hospitals, there are no doctors, and they are out of the health insurance. And instead, they are taken care at home and taken care by the family members, sometimes children. And those economic costs of those who take care of sick family members and lost incomes are not accounted for in many cases. So the economic costs are not well established. So we don't know exactly how much this economic cost is costing. On the childhood obesity, this leads to the adulthood obesity. So this will lead to the economic cost that I mentioned. But at the same time, the pathway through the obesity and their educational attainment and then the lifelong earnings and so on. So these are not well estimated. And this is the area I think we need to do more studies. But as I said, the economic incentives have not taken care of these costs, and some needs to be adjusted. As mentioned in the earlier previous studies, previous speakers on the advertisement and costs. But I just want to add one more, that is agriculture policy. Agriculture policy in Asia and others encouraged production, and some agriculture products such as sugarcane and oil crops that can reduce the price of these products. And then those subsidy programs that encourage production of these crops needs to be reconsidered. the topic of the theme of this session is the future imbalance. And here the balance needs to be considered. Of course, this production of agriculture benefits farmers and industry, but at the same time, the economic cost of the health and obesity needs to be taken into account. Okay, let me stop. Yeah.
Thank you very much to Dr. Yamano for your comments there, looking at the economic costs of childhood obesity for governments, for society, and of course for the economy. Let's take a look now at another angle of this multi-dimensional challenge. We're joined now by Puan Razak of Malaysia. The government of Malaysia is doing different things to try and address the challenge of childhood obesity, including through food labeling, taxing sugary drinks, and promoting healthy eating. How do all of these actions come together? Are you seeing a thread that runs through the actions that are taking place? And are you seeing progress thus far?
Thank you, Mr. James, for the question. I'm glad to be here, be part of this session organized by Japan and also by WHO. To answer your question, I would like to touch first on the food labeling. Actually, for the food labeling, we have two main initiatives, which are the first one is the energy icon. Energy icon is to help the consumers to roughly estimate how many % of their calorie taken by the food that they take. So it's an energy icon that put on the label, whereby the consumer can see whether the percentage of calorie that they took from that product is also exceeding, or how many % of that product contribute to their calorie a day. But actually, this one is we targeted at adult. It's the calorie is 2,000, the percentage of 2,000 kilocalorie. So, but we also educate this to children, so they can use this concept of knowing what they eat and how much calorie that they get from any product. And the other food labeling initiative that we are currently doing is the Healthy Choice logo. I think not only Malaysia, but this is implemented in many countries, including countries in the Southeast Asia. This Healthy Choice logo is we give to the products which are healthier if compared to the same products under the same category of food. Yeah. So the main objective of this Healthy Choice logo is to encourage the industry to reformulate the product to make it healthier. And we know that the children now also goes to supermarket, to buy products. So this is one of the initiatives to encourage the children to choose a healthier products for their health. Yeah. And you touched also, James, on the healthy eating promotion. So for information of the viewers here, actually we just reviewed our Malaysian dietary guidelines, whereby the major revision is on our Malaysian food pyramid, yeah, because the previous food pyramid we put foods from carbohydrate sources at the bottom of the pyramid. We need to say that's the food that you should consume the most in a day. But now we put fruits and vegetables at the bottom of the food pyramid, so that we are encouraging people to eat more fruits and vegetables, yeah, because we know that fruits and vegetables are, are not eaten adequately in Malaysia, especially among the children and also among the adolescents. So based on this food pyramid, we encourage people, especially the children and also the adults, to take more fruits and vegetables in their daily diet. And we translate this food pyramid into our healthy Malaysian food plate, which is, we call it using the concept of quarter half, or in Bahasa Malaysia we call it suku separuh, whereby we encourage people, especially in this context, children, that they should limit their carbohydrate intake, yeah, with just adequate amount of carbohydrate intake, a quarter of the plate, and adequate amount of protein, quarter of the plate, and should have more fruits and vegetables to make it half of the plate, yeah. And at the side of the plate, we put plain water, yeah, to encourage them to take plain water, because I think it's quite not a very healthy eating habit in Malaysia that people like to eat sweet drinks. Yeah, so we encourage the children, yes, especially from young, to take plain water. And in relation to that, I think I must share here that we've already implemented the fiscal measure on the SSBs. Yeah, we implemented the taxation on the sugar sweetened beverages, which contain sugar higher than what we set. It was implemented since 2019, and recently the government has already decided to also taxation on the premixed drink. Yeah, before I think we know that in this region, like Malaysia, in other countries like Brunei or in Thailand, we love these premixed drinks. Yeah, 2-in-1, 4-in-1. Even in Malaysia, I think we have 11-in-1 or 13-in-1. Yeah, and most of the product contain a very high sugar. So we try to, you know, this is not an initiative to actually to put a can on the industry or on the product, yeah, but this is to encourage the reformulation of the product, because we know in Malaysia also the intake of carbonated drink of SSP are very high among the youngsters, yeah. So we want to we try to give option to that, and at the same time we do education that they should take less sugar drinks, yeah. So we also working very closely with Ministry of Education, yeah, especially with the Parents Teachers Association, yeah, in advocating them on nutrition and you know, try to make the school environment is very healthy eating friendly and also physical activity friendly. And in Malaysia, we have about 10,000 schools, and we train Parents Teachers Association in about 8,000 schools, involving about 18,000 people, members of the Parent Teachers Association. And the activities that we are encouraged to do is in terms of the nutrition promotion and also physical activity. Yeah. So I think with that, even though if you look at the data, yeah, from the prevalence of obesity among all age group in Malaysia, we haven't been able to really reduce or to maintain the rate. Yeah. Maintaining the rate is actually our objective of National Plan of Action for Malaysia. But at the moment, we still not be able to maintain the rate. The rate is still increasing. However, it's a bit soothing that we see that for the past 10 or 15 years, the rate of increase is reduced. Yeah, even though the prevalence does not reduce, but the rate of increase is reduced. So I hope that with all the initiative, few initiatives that I mentioned here, and also other initiatives that we're doing, we can you know, try to maintain the rate of obesity not to increase anymore at all age group. Yeah? Of course, we know that obesity problem is not a very simple problem. We see from previous presentation that we need to tackle everything, including the food security and nutrition security. That one also we are working on it, not to tackle obesity per se, but also to tackle double burden of malnutrition that we are having in the country at the moment. Thank you, James.
Thank you very much, Ponzama. It was very interesting to hear you then. You were talking about the 2-in-1, the 3-in-1. You said even there should be an 11-in-1. That reminds me, because you know, when you go through the supermarkets there, you do actually see a lot of that. Thank you very much for your thoughts on the childhood obesity problem from your lens over in Malaysia. Let's go now to another part of the region, because this region is so diverse. It's 1.9 billion people almost who live in the biggest cities and also on islands, like our next speaker, Dr. Davina Nand, who joins us now from Fiji. We're going to hear about some of the school-based interventions that are being used to prevent obesity there, because we just heard there from Ponzama about how schools are being positioned as the tools and the activators of some of these actions, not only at home with the caregivers, but in the school landscape as well. Dr. Nunn, what would you share with us in terms of what school interventions have worked for your people, and how far does it go, and in what ways does it improve children's health and preventing obesity in Fiji today?
Thank you, James. Overweight and obesity prevalence stood at 22% in school-age children, according to the OPIC study of 2004 to 2008. The NNS, which is a National Nutrition Survey, 2015, demonstrated that children aged 5 to 14 years had about 7.2% prevalence of overweight and obesity. So this potentiated a need to look at interventions for improving health in our school-age children. Essentially, there was a recognition that we needed an intervention that was able to change the lens, change the outcomes for our children. And health promoting schools were essentially formed this intervention. And it encompassed 6 factors. The Fiji model itself encompassed 6 factors, which looked at healthy school policies, school's physical environment, a school's social environment, community links, action competencies, school health and promotion services. And this aligned to what we call the Yanuza Island Declaration, which was adopted in 1995 and had a very visionary approach, which looked at nurturing children in body and mind, having environments that invited leisure and learning. It talked about ecological balance as well. And this sort of set the platform for healthy settings in the Pacific. So in 2007, this concept, this action plan was developed for Fiji. And it eventuated in the signing of a memorandum of understanding between Ministry of Health and Ministry of Education in 2009. They commenced with a cohort of about 7 schools and then expanded to 285 schools, which is 32% of all schools currently. And the plan was to ensure that all these schools became health promoting schools by increasing to about 25 schools per district per year. And these were Ministry of Education targets. This HPS settings focused on 3 strategic areas, which included diet and physical activity, water, sanitation and hygiene, and mental health and welfare. Now, what worked, James, was some very key strategies. So the first one was around good communication and ability to market the gains from health promoting schools. And this was predominantly done by awareness and training within the schools, where the schools developed their own action plans within this HPS framework. And we were very lucky to have an influx of schools between 2012 to 2014, resulting in a total of 84 schools that became HPS and had a reach of about 20,000 students. There was phased initiation. So this included initiation, integration, and institutionalization, which ranged from building interest to finalizing an action plan, and then building these action plans into the corporate plans of the school's management. We also looked at resourcing. So each of these schools were given seed funds to help them start with particular areas of the program. There was a focus on workforce. So district coordinators were recruited and they worked with schools to enroll them into the HPS program. There was a clear governance framework and a steering committee, which included Ministry of Health and Education, the World Health Organization, and academia were regularly initiated. Meetings were regularly initiated to discuss grants, progress, and challenges. This also resulted in the implementation of school canteen guidelines in 2013, incorporating some key principles we've learned from the other panel members. So good nutrition, reducing SSBs, and marketing of unhealthy food and its access in school environments. There were key policies put in place, and this aligned to the HPS regional framework, the global HPS standards, our own Fiji policies, which included the Fiji School Health Policy, and other policies that impacted on nutrition. There was an investment in information systems, and you know data is crucial for target setting. So we had Ministry of Education implementing FEMIS and Ministry of Health, which implemented CMRIS, with which we were able to track progress. There were clear criteria involved, and this included adoption of HPS elements. And this included having a HPS committee, a focal point, HPS action plans, regular involvement with the community and surroundings. And lastly, there was a very clear accreditation and recognition framework for schools. And we used a school-based assessment tool and the school assessment monitoring and reporting tool to accredit schools, particular schools with either bronze, silver, gold categories. And we actually had 179 schools with bronze in the bronze category, 23 with silver, and 2 at the gold category. There were tangible gains, and there's greater collaboration with Ministry of Health and Education at strategic levels, of course. We helped to improve the school's physical environment, which led to an improvement in the school's social environment with better interactions and networks. There was greater awareness on healthy living strategies, more attention given to policies and guidelines, and improved attendance in schools, not only by school children, by the teachers themselves. There were healthier snacks and lunches provided by parents because we restricted unhealthy food and SSBs in the school environment. And of course, improvement in WASH, as well as accreditation. And of course, we do have challenges, James. We haven't completely addressed all the areas. So we are, as a coordinated and concerted body, thinking about sustainable financing, greater coordination and collaboration, especially with Ministry of Agriculture, Ministry of Youth and Sports, the Fiji Sports Commission and Council. And of course, looking at the implementation of our policies, enforcement of our policies, greater stewardship and political leadership in the arena, and a commitment to expansion of HPS with good investments into research and development, routine monitoring and evaluation, and of course, enforcement of the school canteen guidelines. Lastly, sort of the impact of an impact evaluation will need to be undertaken, and key areas looking at how HPS in these schools have impacted on school children themselves. And you know, with impact evaluation, it takes years for us to do proper impact evaluation. And this is one of the target areas for the steering committee. And we are committed to our children. They are our future, and investments in the HPS interventions, because it has shown improvement in school environments. It has shown healthier living impacts for both our children, teachers, and those who work around school environments. However, once again, the real impact on the health status of children is something that we still need to assess, and this is something that Fiji will be focusing on going forward. Thank you.
Thank you very much. You know, I'm reminded when I listened to you, not only about the importance of communications, because you hit on that very important point there. I mean, when you look at the food companies and what they're doing is really, really clever, in inverted commas. They're telling stories around food. They're appealing to the emotions as well as to the taste. They're manipulating the tastes and the choices of our young people and even us as adults. But I think it was, wasn't it a former president or prime minister of Fiji who used to go to all the schools in the country to talk about good choices around HIV and AIDS. And what he then used to do was to then bring in the parents and the grandparents, because he recognized that educating our children during school hours only was not going to be sufficient. It had to be a cultural movement through the entire community, starting with the family and the household in which they live. So it's very interesting. Thank you very much to Davina Anand again for speaking to us there about childhood obesity in Fiji and the school interventions that are working for you or are beginning to work for you there. Let's go now back to Southeast Asia. We're going to go to Singapore and to Ms. Basuki Utravati, where childhood obesity in Singapore is a growing concern. There's been a community-based approach also there for healthy lifestyles to prevent obesity on the island. Ms. Utravati, what are some of the drivers of childhood obesity in Singapore? Is it the advertising? Is it the marketing? Is it the television commercials? Is it the instant gratification of the ingredients and the way that they're presented to consumers and future consumers? And what would you say Singapore is doing, if you're speaking now in this space, that other countries here can take away with them because it's working for you or may work for them?
Thank you, James. And thank you to the organizers for inviting me to share on behalf of Singapore what we are doing at the Health Promotion Board. Before I answer the question that was posed, just to share with you all the data that we are dealing with. In Singapore, obesity and overweight among our children aged 7 to 18 years has increased by 2 percentage points from about 11% in 2011 to 13% in 2017. Unpublished data from Health Promotion Board's health screening for the younger children, these are preschoolers aged between 5 to 6 years old, really shows that about 4% of our really young children were also overweight and obese. This largely, it boils down to economic impact, economic growth, and how as a society we have embraced the conveniences that comes about with processed food, with food being available. The moment we in Singapore step outside our homes, there's just so much food choices for us. And of course, COVID-19 also exacerbated the whole experience with, in the past 22 months, people not being able to go out as often as they want to exercise. And imagine that impact. I mean, children see, children do, how that would then impact the children themselves. So I'm just going to lay the stage here that it's not just the availability and the accessibility of food, but it's also how we have embraced our economic growth and that dual income households coupled with the situation right now, how all of that is also affecting children and childhood obesity. Moving on to what we are doing, we are all in this path of learning, really. And we also learn very much from what other countries have been doing. But just to share, to address and arrest the increasing BMI for age trajectory that we have seen, we have noted that there's a really an interaction between the obesogenic environment that we live in and the intergenerational condition, the societal perceptions that needs to be addressed. So we have been looking at it holistically, as well as addressing people conception or words that may be passed in Singapore. Should you come, at one point in time, should you come to Singapore? Overweight kids, fat children are cute. Young teen children are, I mean, the question that usually is asked is, are you not feeding your child enough? Such perception also leaves parents thinking that I have to feed my child, even if the child is not hungry, even if the child is saying that I don't need so much. Like one of our Dr. Sone was sharing earlier, the whole idea of serving the kids bigger portions because there's value for money in there, that needs to be addressed. And all of this is going to be holistically looked at by an interagency child and maternal health and wellbeing task force that was just announced in March this year. So besides Ministry of Education, Health Promotion Board, Ministry of Environment, we are also working very closely with research agencies in Singapore, as well as the public healthcare institutions to also close the last mile necessary assistance that can be provided for families that need the medical assistance. I'll come to that later. But just to quickly touch on what the interagency task force is going to be doing. Besides economic growth, we have also noticed that maternal obesity is another area that needs to be looked into, and this cuts across regardless of income levels. So what we are doing there is going upstream, really relying a lot on Baker's hypothesis of how the first 1,000 days from preconception to about 2 years of age is important. And how those behaviors very early on in life also shapes their attitude and consumption of health and healthy lifestyle. A lot of efforts will be expanded on addressing and supporting the mother, the new father in being able to provide healthier options for their children. And that healthier options, idea of breastfeeding up to second year of life, not feeding the child when the child is not hungry, allowing the child to self-serve food for themselves at a particular age when they're able to. All of that is not just to the parents, but also to the caregivers, the educators, the early school educators who are going to be supporting our children as mothers and fathers go back into the workforce. A lot of us work from home today, but we don't expect that to be the case for a long time. On top of addressing all these lifestyle behaviors that are going on, there's also a need to look at the environment. And on that front, Ministry of Health Promotion Board has been working to influence the choice architecture. And by that, I mean the availability, making available children's meal, of a portion that the children can consume at the food and beverage establishments that we are working with as well. So this is on top of all the regulations that are going to be coming up in the next 2 months, in the next year or so. The whole idea was also about going back to promoting bonding. The hook here is not so much, for parents, it's not so much about give your child a healthy life, but it's really about allowing them to bond, participate in activities that are taking place in the parks by our counterparts in the national parks, in Active Sports SG, Sports Singapore, sorry. And really getting that information to the parents, the child out for participation activities when the children are young. I just want to round this up by saying that in Singapore, we have recognized, just as my fellow panelists have been sharing, there is really no silver bullet, no magic bullet, no one solution. It's really about all of us working together as a nation, as a country, it's a global phenomenon, and we really need to be able to address it holistically, working hard to identify collaborations and alliances across agencies, across sectors, and really encouraging everyone to come on board and overseeing infrastructural facilities that makes health choices the default choices. That's really what we are working towards. Again, I would just want to touch on the point that I mentioned earlier. Even the words that escape our mouths, the lexicon that we use, which shapes the societal perception, is something we want to be addressing. So we want to hear less of, oh, the child who is so chubby is cute, and parents being, for lack of a better word, blamed for bringing up a teenage child. So those are really some efforts that we are working on. And as we have just started on our journey, working together with the research agencies, we hope to be able to share this widely, be it with the Children Center for Holistic Initiatives to Learning and Development, CHAL, or even Growing Up in Singapore Towards Healthy Outcomes study. Thank you very much, James, for giving me the opportunity. Over.
Thank you very much, Ms. Ujjavati. You know, there was this, this sort of promote, I thought it was a very, very revealing documentary that came out many years ago called Food Inc. I think it came out more than 10 years ago. And, you know, Ms. Ujjavati, you were talking there about, you know, the judgment on parents and also the vocabulary that we use, because, you know, that determines then, you know, is your child cute, and, you know, how long does that cuteness last for by the time they become teenagers? Are they still considered that? But, you know, this documentary, I think there was a Hispanic family, which also shows that our health choices and our access to health services are still very much drawn on lines of people of color in many parts of the world, that they said that it was very difficult. It was more expensive for them to eat healthily because the father was a truck driver, and they found that, you know, buying burgers, which were on promotion, they could give a complete meal in their head, you know, burger, side dish, and also a soda, a carbonated drink to their children, because there aren't facilities to cook, and simply vegetables have been made to be very expensive in supermarkets. So it's really, really interesting what you were saying there, and widening out our understanding of the challenges that our families face and our communities face. Let's keep that in mind as we cross now nearby to you, actually, to the Philippines. We're going to go now to the city of Mandaluyong, as we've learned from different countries here today. I mean, we dropped into Australia, Malaysia, Fiji, we went to the ADB in the Philippines. We just heard from Singapore, but back in another part of the Philippines, where we're going to speak now to the mayor of Mandaluyong City. We're going to listen to Ms. Carmelita Aguilar Balos to talk about how her city is addressing obesity, again through a community approach and on a community level, and also the response of that community, the people that they serve, towards a program and the impact of such a program.
Good day, ladies and gentlemen. This is Mayor Menchi Abalos of Mandaluyong City, Philippines. As the first female local chief executive of Mandaluyong City, The support of the community was solid and challenging. It was a rough and difficult process, and involvement of various stakeholders happened gradually. Our journey in the city in attaining excellence in health and nutrition program implementation, more particularly our fight against obesity, was a difficult route, and it never happened overnight. The response of the community in general was truly enriching, and we have attained our goal to achieve only the best for the young sector. It is a humbling experience to show you a snapshot of what we have started, for what we have done, and for what we desire to share to other cities in the Asia-Pacific region. Among these notable programs and innovative approach include the localized implementation of 10 commandments, derived from the 10 Commandments, and Pinggan Pinoy Filipino Plate, which serve as the promotional guidelines showing simple and easy recall dietary and physical activities designed to help the Filipino nutritional status. Moreover, the O-Obispo, or the overweight and obesity elimination through nutrition education program, has been institutionalized, focusing heavily on nutrition education activities. Importance of proper diet and exercise, nutrition program classes, Zumba events for kids and moms, Nutri-Fun Run, and other kiddie calisthenics that gain popularity among households and the entire community. And lastly, I want to share that political will and proactive leadership is the most effective and the defining factor in determining the success of our anti-overweight obesity program, which gained the participation and the support of the people in our target stakeholders. The impact of our program to address overweight and obesity among children in the city of Mandaluyong have been truly strong and relatively positive. The increase in awareness and the high indicative participation of various stakeholders to our programs have reached multiple benefits among people in the community and for those who were subjected to the programs. Likewise, projects and activities focusing on weight reduction are integrated in the development plans and other existing plans in the community for funding support and community extension services. As a result, after our long journey of redefining our initiatives to enhance our nutrition and health programs in the city and to specifically combat malnutrition, overweight, and obesity among our children, Mandaluyong has been sought and conferred in the Nutrition Honor Awards in the effective implementation of all our health and nutrition programs.
Fantastic. Thank you very much to the Mayor there for speaking to us. We've now come to the end of the panel discussion. I'm going to try and move this as fast as we can because we've overrun quite markedly. Throughout this session, we've heard the varied dimensions of child obesity, but more importantly, the ways in which we can learn from one another in meeting the needs of our own people and of people elsewhere in the 21st century. Obviously, we can start about being more mindful about what we eat and how we consume. Governments can also help in promoting the food environment, like regulating unhealthy food marketing and advertising to children, food labeling, as we heard, which is coming out in places like Argentina, taxation of sugary drinks, promoting healthier school food environments, which we're seeing over in Fiji, and also using multiple prevention efforts, including through community participation and ground-up approaches, which I think we've seen from all of our speakers on this panel. So we need to do more to reduce childhood obesity because of the really high financial, economic, and social impacts, as well as the impact more so on the soul, on the body of our future generations. So thank you to all of our panelists and participants for being with us. Very quickly, we'd like to go briefly to our two closing speakers. We'd like to invite first Dr. Koji Sasaki from the Ministry of Health of Japan, and Dr. Angela Pratt, who's a friend to many of us here at the World Health Organization, WIPRO in Manila. Your closing remarks, please.
Hello. So I'd like to make a few closing remarks of this event. In conjunction with the Nutrition Summit for Growth 2021, we were happy to be able to host this event as an aside event. First of all, I'd like to extend my sincere thanks to everyone in the world who participated in this event. In this event, lots of support were given by the world governments, the world organization, industry, and the private sectors, and all those speakers who gave us a brilliant presentation. Thank you very much. Despite your very busy schedule, you gave us really informative, good discussions, and also we really enjoyed your deliberation and at the panel session. And as for the measures against obesity, depending on countries and regions, various initiatives have been underway, I believe. And in today's event, we were able to obtain very informative cases from presenters considering the health of child. So not only that would affect the future of the children, but that is a key for the future growth of the society and the country. And because of that, the countermeasures of obesity is the imminent issue globally. So we have to be creative to come up with the good initiative to these challenging issues. So going forward, I'd like to take advantage of the learnings we had today for the future initiatives in Japan. So thank you very much, Mr. Sakai. Thank you very much for your coordination and planning. And also everyone at WPRO. And so this is my closing speech. Again, thank you very much for your participation, and thank you.
Thank you so much, James, colleagues, guests, ministers, panelists for being here today, to all of our brilliant speakers and panelists for joining us. You've been absolutely fantastic. Just very briefly to close out from WHO's perspective, in organising this session today, we really wanted to shine a light on the gravity of the challenge that we face with escalating childhood obesity rates in the region, but to do so in a way that offers hope, that shows that there are solutions at school, in the community as well, of course, at the national, macro and policy regulatory level, and that there are huge health, social and economic dividends from investing in those solutions. And all of you have helped us to do that. So really, thank you very, very much. Thanks also to everybody who has joined us online watching the event today. We hope that this session has helped to inform, but also to inspire the action, the advocacy that we so desperately need in this area. So finally, on behalf of WHO, I'd really like to thank our colleagues at the National Institute of Public Health and the Ministry of Health, Labour and Welfare of Japan for co-sponsoring and co-organising this session with us today. It's really been a pleasure to work with you to put this session on. And of course, thanks to our brilliant moderator, James, for bringing your very special brand of magic to this session, as you always do. We really, really appreciate your time as always. Back to you to close the event.
Thank you very much, Dr. Angela Pratt, for bringing us to a close there and for acknowledging all of our co-sponsors and co-organizers who are at the venue over in Tokyo. I wish we could be there with you in person at this very special Tokyo Nutrition for Growth Summit event. In fact, I hope one day that the world will be closer together, side by side, as allies in our fight against COVID-19 pandemic and against this epidemic of childhood obesity. But I think today, with your expertise and with your collective leadership, we've moved another step closer to that. I'm sure that the live stream will be available on demand playback. So please go to that and please share it with all your friends. And of course, go back to the WIPRO website where you can find some of those videos that we showed today. Thank you to everybody in Tokyo, in Manila, for bringing us together once again. Take care. Goodbye.